to Seminole County's COVID update press conference today. I'm Chairman Jay Zembower of the Seminole County Commission. On behalf of the 7 cities and my fellow commissioners, we welcome everybody here that's tuned in, as well as the news media, as getting the news and all the updates out in a timely fashion to the community. Also today, we're going to have Fire Chief Otto Drozd with us today, who's going to speak. We're also going to have our Emergency Management Director that is a frequent flyer everybody's come to know during this unfortunate time, Mr. Alan Harris, as well as Donna Walsh, our Officer of Health here in Seminole County, are all going to talk about specific things during today's press conference. First, I want to say again, thanks to the public, thanks to the businesses. I know everybody's had a great deal of patience. You've seen, if you're watching the COVID updates, and Donna Walsh is going to talk a little bit more about that, as well as Alan will, is we really are blessed here in Seminole County that the citizens have heeded the warnings. We've been able to minimize this impact the best we could. Everybody's doing the great work. The businesses that are starting to open, for the most part, are doing what they need to do to try to make people feel safe. And I would just urge those businesses, as well as the community, continue to be safe. Now that we're at 50% occupancy under the governor's newest declaration, it really is going to boil down to how we conduct ourselves, how we interact in public, how we get to the next phase. So it's going to be on all of us to continue to be vigilant and watch what we do, keeping our hygiene, washing our hands, keeping our hands away from our face, making sure we try to keep those distances. More will be talked about that, I'm sure, later in the press conference. I also want to talk to you about Memorial Day, which is upcoming. A lot of questions have been asked about Memorial Day and those services, so I'm going to share a little bit of that with you all today. In Seminole County, we're proud to honor the members of our nation's armed forces and first responders who made the ultimate sacrifice in the line of duty through a Memorial Day remembrance ceremony at the Seminole County Heroes Memorial, which is right here on the premise at the Emergency Center and the Sheriff's Office. It's going to be held virtually. It's this Friday, May 22nd at 9 a.m. There will be honor guard presentation from the Seminole County Sheriff's Office and Seminole County Fire Department, presentations by veterans, formal rendering of the honors of a 3-volley salute, playing of taps, ringing of the fire bell's final bell. The ceremony will close with Amazing Grace played on the bagpipes. And anybody that knows some of my background, being Scottish, I really enjoy the bagpipes. So I would ask that you all tune in and enjoy that ceremony. Out of abundance of caution, the members of the public who would like to view the ceremony are encouraged to join virtually on Seminole County's Facebook page. That's facebook.com/Seminole County, where the event will be live streamed. Also on Monday, May 25th, county businesses will close in observation of Memorial Day. However, the landfill and transfer stations will remain open for regularly scheduled solid waste collection will occur in the unincorporated areas. So I know a lot of people have been spending a lot of time at home and they're doing cleanups or spring cleanups, so you will be able to take your refuse if you desire to the transfer stations. Our libraries, as a lot of you know, we were forced to close libraries, so I'm going to give you some news on that. 4 of our library branches reopened over a week ago with enhanced cleaning. Social distancing measures are now in place with 25% occupancy. In the first 5 days of operation from May 12th to May 17th, over 900 residents took advantage of the new curbside services that we're offering. While the branches were closed, the library registered 190% more new library cards during the same time as compared to last year. We welcomed 1,200 new card holders from March 17th through May 18th. We also saw an increase in users checking out our e-books. That's an asset that a lot of people understand and realize. The way we used to engage libraries, we now have an e-book program that people can go online and check out that. So another good asset here in Seminole County. Our Seminole County Economic Development is getting ready to roll out a local small business grant program to offset the significant revenue loss during the COVID-19 pandemic. As you all know, I've spoke about this on a couple occasions. The CARES Act funding that came from the federal government, Seminole County unfortunately did not meet the threshold of the 500,000 population. Our population is approximately 467,000. Other counties throughout the state and the region who are over the 500,000, even if they were one person over 500,000, received $90 million. A lot of that money is being utilized by these counties for this purpose. However, here in Seminole County, we are going to roll out a business assistance program. We appreciate all the business owners who provided us the feedback to help us understand what their impacts have been during this downturn. The details will be coming in the few coming weeks for eligibility, how to apply. You can get this information on our website at prepareseminole.org or by calling 407-665-0000. If you click on the business tab of that Facebook page here at prepareseminole.org, you'll see that information as it starts to populate and find additional resources for the businesses as we begin to roll out this plan. To date, we have over 600 residents that have responded to this request to give us input on the business impact. Last count, the impact's almost $76 million of impact to our small business community. As our community not only reels from the COVID impact, we're now seeing the economic downturns, and in order to get these things back up, we've committed here in Seminole County to do what we can for the small business people to help them find their way. Otherwise, we all know that a lot of people are hurting from lost jobs, as well as many have either closed their businesses or on the verge of losing their businesses. Many of these are small mom and pop operators that unfortunately don't have the wherewithal to hold on for months at a time. Even though some of the federal programs that have been rolled out, some have been able to take advantage of that assistance. But the reality I can speak from as a small businessman myself, those things are good, they can help, but they're not long term. The longer this lingers and the less we're able to get the people back to work, the more discouraging it is for those business owners and just wreaks havoc throughout the community. So we're going to roll that out. Keep an eye on that as we come forward for your application, and we'll do what we can to help there. As we also see service businesses, these results are published 3 times a week at prepareseminole.org. Again, see the business tab, click on it. You can see the updates, and you'll also see any and all assets that we're going to bring to bear as you can apply for these as a small business operator. At this time, I'm going to turn it over to Alan Harris, who's going to come up and talk to you about what's going on with the EOC. Thanks again.
Thank you, Chairman. I'm Alan Harris, Emergency Manager here in Seminole County. We've been working with the businesses as they begin their reopening process. Pursuant to Executive Order 20-123, the governor had given direction to the counties to assist with vacation rental and amusement park openings. So we have been working with vacation rental organizations here in Seminole County, developing a request to the Department of Business and Professional Regulations to allow us in the county to open up vacation rentals in our community. So we have that letter, and we'll be sending that to the state of Florida for their consideration. While there aren't a lot of amusement parks in Seminole County, there are a few, so we are working very closely with the amusement park owners. That is run through the Department of Agriculture and Consumer Services, and we have written letters of consent and support for those reopenings. And most of those are smaller type amusement parks, but certainly fun for the families here in Seminole County. All of the safety procedures and protocols that they have sent to us were quite outstanding. They all followed the CDC guidelines, so we are very honored to be able to support them in whatever way we could. This morning we had the first of multiple outreach missions to faith leaders. We had over 45 faith leaders on our webinar conference call this morning discussing the reopening plans of faith organizations. And as they plan for the reopening of faith organizations, some safe procedures, best practices from across the state of Florida and the nation. We had an incredible dialogue with those faith leaders this morning. Just a good way for us to begin that discussion as some of them consider individually how they'll reopen their faith organizations. Testing continues here in Seminole County. We have a pop-up community test site tomorrow. That's going to be at Jackson Heights Middle School at 41 Academy Avenue in Oviedo. Our partners with True Health, a nonprofit organization, is assisting with that. we ask that everyone bring their photo ID and medical insurance card if you have it. So definitely the photo ID and the medical insurance card if you have it for tomorrow's activity, again from 10 to 2. Next 2 Saturdays, we'll be doing activities at various churches. The first one is at St. Mary Magdalene Church, and that's this Saturday from 10 to 2, and that's in Altamont Springs. And the following Saturday will be at the Iglesia Cristiano, which is on Dog Track Road in Longwood, again from 10 to 2. This particular, these 2 pop-up sites are being done by our friends over at the American Muslim Community Clinic, again, a nonprofit organization that has assisted us with testing. For those 2 Saturday events, we are asking for individuals to register. To get information on how to register, you can call our Citizens Information Line at 407-665-0000. At this time, we have not been able to secure a drive-in antibody testing site, but there are multiple locations in Seminole County. We have identified 7 different locations where you can get antibody testing here in Seminole County, and those are all up on our website, prepareseminole.org. I know that we don't want to talk about it, but in the next 2 weeks is hurricane season, so we certainly wanted to let you all know that we are preparing for hurricane season. While we're responding to COVID-19, we're preparing for the hurricane season. The hurricane season this year will look quite a bit different than the past hurricane seasons. For example, many of you that have watched the television, the news, things like that, during these events, you see the EOC, the Emergency Operations Center, full of people. We have about 114 individuals in the EOC. Typically, during a hurricane, we are decreasing that to 34. So that is a considerable decrease, and instead of bringing all the folks in here to the Emergency Operations Center, we will have remote coordination sites where smaller groups can meet to coordinate specific types of tasks. This allows us to maintain our social distancing and also allows us to maintain enhanced cleaning services and things like that to prevent the spread of COVID-19. Special needs is going to be different this year. We want to encourage, of course, anyone that is special needs, so anyone that is on oxygen, requires electricity to run medical devices, things like that, to register for our special needs program. It is very important that you register this year as we need to prepare for you coming to the special needs shelter. You can register for our special needs program by going to prepareseminole.org, prepareseminole.org, and there's a link right there that says special needs. You can click there and register for the program. We will need just some basic information, how to communicate with you, how to contact you, and then what services you may need at the special needs shelter so that we can make sure that we have the proper individuals there. If you need evacuation prior to a hurricane, this year is going to be slightly different in that we will be taking temperatures prior to getting on buses. So if you need assistance with transportation before you get on a bus, your temperature will be taken, and there will be a triage before you get on the bus. If for some reason you have a temperature or you are unable to go through the triage system, then we will find a different type of transport to a medical type facility, not a hospital, but a medical type shelter for those individuals. Our sheltering plan is also going to be very different, where our shelters normally opened up in schools and they were normally in large gymnasiums and cafeterias and things like that. Obviously with social distancing, that is not possible anymore, so we are looking to utilize classrooms, isolation rooms, things like that to keep people separated, smaller groups, certain feeding times for individual groups inside of the shelter to minimize exposure of individuals to each other during the event. Prior to entry into the shelter, there will also be triage as well as temperature checks prior to even getting into the emergency shelter. So quite a bit different than in past. Social distancing, of course, will be monitored during the entire activation of the sheltering activities. To register for information on all types of alerts, of course, we encourage people to register at alertseminole.org, and it's got this is how we will notify our community of shelter openings and things like that. So if you go to alertseminole.org, you can register for our alerting system. And of course, we want to remind everyone, May the 29th through June the 1st is Storm Supply Sales Tax Holiday, so you can get some of your storm supplies tax-free on that week. So I know It's hard to think about that while we're also responding to COVID-19, but I wanted everyone to know that we are considering those things. We are planning for those things. That is not out of our mind. While we're still responding to COVID-19 and the needs in our community, we are, of course, thinking of the future as well. We've already had our first named storm, so hopefully we do not get hit this year in Seminole County by a tropical event, but we are going to plan for that, of course. With that, I'd like to turn it over to Donna Walsh, Department of Health.
Good afternoon. Thank you, Alan. First and foremost, I would like to commend our community, as Chairman Zembower mentioned, for all of your work in helping us to keep the spread of this disease in our community and also to save lives. Just want to give an update on what we're looking at today. So far in Florida, as of this morning, there have been reported 47,471 positive cases of COVID-19, of those 2,096 deaths. And in Seminole County, as of this morning, 444 confirmed cases now, and 12 deaths with 105 hospitalizations. We have, as Alan mentioned, expanded our testing here in the community. We have tested close to 16,000 folks now in Seminole County, which is a little over 3%, about 3.3%. We also have an initiative going on right now statewide, May today, to test at least 2% of our population in the month of May. We're a little bit over 1% of that, of our population right now, but we are confident with our community partners, as Alan mentioned, American Muslim Community Clinic, True Health, as well as Bueno Pharmacy, and the health department, that we can accomplish that and even do more. So I have today presented as well the graph that you have seen in previous press conferences, the orange line indicating the lab report date for Seminole County of the cases that have been reported, and the blue line the onset date of symptoms. As you can see, we're still going down here. The curve is declining, which is a good thing, and as you've heard, referred to as flattening the curve. You know, the question is, as we have reopened businesses to 25%, and as we look to reopen businesses to 50% and so forth in phase 1, 2, and 3 of the reopening plan, how is that going to impact the number of cases that are reported to us? So to give you some perspective, in April, about a month ago, the week of April 19th to the 25th, for the week we had 44 positive cases of COVID-19 reported to us. The next week, April 26th to May 2nd, 41 cases. May 3rd through the 9th, 15 cases, and May 10th through the 16th, 14 cases. So we are seeing the number of cases reported to us continue to decline. There are some days you see little blips here that we may have more than others, but on average, on a daily basis, we are receiving 0 to 5 reported cases a day. So, so this is positive. It's encouraging news. It doesn't mean that we are entirely clear at this moment, and it's only because of your efforts that we've been able to accomplish this. So we still encourage you to be vigilant and to follow those guidance that are out there as far as wearing masks if you're less than 6 feet from somebody. If you enter one of the businesses, you know, many of the businesses are required to wear a mask if they know that they're going to be less than 6 feet from their patrons. But if you feel like you're entering a crowded area, for certain, put a mask on to protect those around you, the cloth mask to protect those around you. So as far as monitoring, you know, in total to date, we have monitored cases and contacts, about 1,172. Currently, we're monitoring 74 people. So that tells you that, you know, many people have completed that monitoring period, whether they're cases, persons under investigation, or asymptomatic folks who have tested positive. So we're monitoring 26 cases right now, persons under investigation, meaning those who have shown symptoms, but they're waiting for test results, and asymptomatic persons. So, like as I mentioned, this is very encouraging news, but we can only continue on this trend if we all, you know, take those precautions as we move forward. It's really too early to determine because we're just coming up on that 2 weeks after reopening, 25% partial, and now going to 50% in some areas. It's really too early to determine what the full impact is of the spread of this disease in our community. We are watching very closely every day, multiple times a day, and as guidance comes out, as we see more trending, we'll definitely be able to share that with our community and give updated guidance as we have. The other is something that you have seen in the news, I am certain, is the development of what is considered a multi-system inflammatory syndrome in children. New York reported the cases initially in the United States. To date, we in Florida have seen evidence of 2 cases in a Miami area, South Florida. due to this, this is something that's, as the evolution of this virus continues, that we learn more about. So as the researchers and doctors who have cared for these children have seen thus far, is many of these children are testing PCR negative, even though they're exhibiting these symptoms. It's like a toxic shock syndrome, organ failure, as well as fever and inflammation throughout their body, and oftentimes rash. But they will show what they call IgG, or antibody positive. So there's still more to be learned about what impacts, long-term impacts, this virus is having on folks. What has happened as a result of that is that our state, as well as other states across the nation, and the Centers for Disease Control and Prevention, have put out enhanced surveillance to all of our healthcare providers so that they can watch for these symptoms and report them right away, so we can learn more about this and make sure that children get into care as soon as possible. There are some children who have died as a result of this syndrome, but there are many who have survived with early and appropriate treatment. Alan already mentioned the testing that is going to occur throughout the county in the coming weeks. And I can't thank the county again and our community partners for all the support that they have provided during this event. Just a couple reminders, the Seminole County Citizens Information Hotline is still active and available, 407-665-0000. We also have the Department of Health call center that's available, dialing the same number, but hitting option 1. We also have a state call center that's still active as well, 24 hours a day. That's 1-866-779-6121. And you can also text to 888-777 any questions that you may have. With that, I'd like to turn it over to Chief Drozd, and he will give us an update.
Good afternoon. And while the men and women of the Seminole County Fire Department are fully engaged in the COVID-19 pandemic response, I'm here to discuss a couple of issues that we need to deal with within Seminole County. Seminole County is in brush fire season, and yesterday the Seminole County Board of County Commission Chairman Zembower, signed an executive order issuing a burn ban for Seminole County. This was issued as a result of the drought index reaching 502 on a scale of 0 to 800. This is a significant juncture in Seminole County, and over the last several years, between 2016 and 2019, we have averaged over 130 brush fires per year. So far this year, we have had 68 brush fire incidents. Some of the significant wildfire responses in the recent past include the Seminole Woods Fire in Geneva, which covered over 80 acres and endangered 10 structures, as well as the Sterling Fire in Chuliota, which covered over 170 acres, endangered 100 structures, and caused significant damage to the Makawi Girl Scout camp. So what does the burn ban mean for our residents? At this time, the general public is prohibited from conducting any open burning, including campfires, bonfires, trash burning, and other open incineration without an authorized burn permit from the Florida Forest Service. One of the leading causes of brush fire are from escaped campfires and yard debris fires. Therefore, citizens are asked to be vigilant and refrain from any open burning. Residents can still continue to use above-ground gas and charcoal grills. However, citizens are urged to ensure charcoals are extinguished upon completion of cooking and using these types of grills. Barrel-type barbecue smokers are also allowed, as this is not considered open burning. However, they should be kept away from heavily vegetated areas. The burn ban shall remain in effect for 7 days and either be extended or rescinded based on prevailing weather conditions. As we head into the Memorial Day weekend, the weather forecast is predicting rain. However, the burn ban will remain in effect. Also, lightning can spark brush fires, and we ask residents to call 911 if they see a column of smoke. In regard to our wildfire season, the Seminole County Fire Department does encourage residents to take every effort to prepare your homes. A little prevention effort can truly make a huge difference. Homes that are at greatest risk are those located in the wildland-urban interface, such as the areas of Geneva, Chuliota, and Paola, as well as other locations throughout the county. What you can do to become part of the fire protection plan is create a defensible space around your home, at least 30 feet, and 100 to 200 feet if your home borders a heavily wooded area. The defensible area will break up the vegetation and not allow the fire to travel to your home. And it also provides a safe space for firefighters to defend your homes in case of fire. Please make sure our emergency vehicles can reach you, and that is by keeping a 12-foot wide and a 15-foot high vertical clearance for our emergency vehicles, as well as prominently displaying the address to your home. Other tips include thinning your trees, removing ladder fuels, and ladder fuels are those that go from the ground to the tree or from the ground to your home. Remove those and keep at least a 6-foot vertical clearance between trees and other vegetation. Remove dense fuels from around the home, prune your trees, remove large grouping of plants from your decks or your fences. Allow no flammable vegetation in contact with the structure. Lastly, as we enter into the Memorial Day weekend, it is known for barbecues and time with family, either in the backyard pool, beach, or in many of the lakes and rivers we are fortunate to have here in Central Florida. The importance of drowning prevention cannot be overemphasized. Among prevention injuries, swimming pool drownings are the leading cause of death for children 1 to 4 years old. Children 5 years or older are more likely to drown in natural waters, such as ponds, lakes, and rivers. The risk of drowning in open water increases with age. The average 10-year-old, for example, is 3 times more likely to drown in open water than a pool. Citizens are urged to implement preventative measures to follow the following safety tips. Never leave a child unattended or near water. Be on the lookout, assign a water watcher. Install proper barriers, covers, and alarms on and around your pool. Fence off all pool areas with at least a 4-foot high fence. Make life jackets available around natural bodies of water. Teach your kids how to swim and learn CPR. The more layers of protection, the better you will be able to survive a drowning incident. On behalf of the men and women of the Seminole County Fire Department, we thank you for your vigilance and want to wish you a safe and happy Memorial Day weekend. And now I'm going to turn it over to Officer Weber with the Florida Fish and Wildlife.
Thank you, Chief. As we know, Memorial Day weekend's this weekend. It also coincides with National Safe Boating Week, so I'm here just to give a few tips about being on the waterways. Like Chief said, any child under the age of 6 on a boat in the state of Florida is required to wear a life jacket at all times. That's for their safety. We encourage everybody to wear a life jacket while you're on the boat, especially in the waterways of the state of Florida. Some of the major things, though, like it's been said, we live in the state of Florida where the weather can change at the drop of a hat. So before you go out on the water, check your weather. Also file a float plan that's as simple as letting somebody know where you're going to launch from, what time you intend to return. And our officers are going to be on the waterways this weekend patrolling to keep everybody safe. So make sure you check your safety equipment every time you go out on the water. I mean, it's important not only just because of Memorial Day weekend, but every time. Make sure your safety equipment is serviceable. You know how to use it, where it's located. It has to be readily accessible. And while you're on the waterway this weekend and any other time, if you're consuming alcohol, the legal limit on the waterway in the state of Florida is 0.08, and FWC has a 0 tolerance for boating under the influence. If we catch you boating under the influence, you will be arrested. Just designate as simple as designating an operator. That way, everybody goes home safe, and you can have your barbecue when you get home, and we don't have any tragic events. The next thing is maintain a 360-degree scan of where you're going. That way you can see if there's other boaters, underwater obstructions, or just anything that may prohibit you from operating your boat in a safe manner. So the main things, we want everybody to go out and enjoy the resources in the state of Florida, but have a safe weekend and get home safe and enjoy the rest of Memorial Day weekend. Thank you.
Thank you, Chad. We appreciate FWC being here today to get out the message. We've covered a lot of things today, and I think, the information about Memorial Day, look, folks, a couple things. We're not able to get out in public like we typically do. We need to remember those men and women that paid the ultimate price for what we actually have today. So I would ask you and urge you, please celebrate Memorial Day at 3 o'clock on Memorial Day. Wherever you happen to be, please give a moment of silence and respect for the great freedoms that we have here in this country. I would also urge, based on the fire ban we have going on, I know Memorial Day is also a big partying time. I'm a native Floridian, I get it. We love big bonfires. We love big fireworks. We love to go out on the lakes. Everybody's been pent up and cooped up for a long period of time, so the expectation is we're going to have a lot of people on the waterways. Just take a deep breath, enjoy yourselves, distance socially, enjoy your family, but please be safe. Us moving to the next level absolutely depends on you and I, all of our community, so we continue to be safe, so we can get more opened up here in the state of Florida. So with that, I again thank everybody for being here on behalf of the 7 cities, the Seminole County Commission, my fellow commissioners, as well as want to thank the media and all of our great staff. I'd also be remiss if I didn't share a quick story we often don't hear about our emergency management division. This past week we received an email from a woman who was in quarantine that was very grateful that our people were calling her. She was all by herself, had no family or friends close. She looked forward to that phone call every day from our staff and our EOC, as well as reaching out to her on Mother's Day. That's what Seminole County is all about. What a great story. These are the stories that our men and women are so humble that they don't share, but I felt a need that we should share that. That's what Seminole County is all about, helping each other. We've done a great job. So with that, thanks again. We appreciate everybody being here. We'll take any questions that anybody might have, and then we'll move into our Spanish translation.
I have a question for Donna. Over the weekend, we found out that Advent had lost or cut ties with the lab, testing thousands of COVID-19 tests.
Right.
We know a lot of those were here in Seminole County. I was one of them that got a negative but unreliable test. How does that impact the numbers, I guess, or does it impact the numbers when it comes to this?
Sure, it's an excellent question, and I think they're still sorting that out, honestly. It certainly can impact the numbers. We'll have to look at, out of those that they reported could be unreliable, how many were actually here in Seminole County residents. To date, I couldn't tell you exactly what that number is, but it could. However, I don't think, honestly, that it's going to impact the trending that we're seeing here.
And what do you tell people who maybe got one of these tests to want to go back out and get tested again? Because they are asking people, do you want to get tested again? I was asymptomatic, so I said, no, I don't need to get tested again.
Right.
So what do you tell people to get them to go get tested again, I guess?
Just what we're telling you today. If you would like to get tested, we have those resources available. We vet the collection kits very closely with what we're receiving, either through the Emergency Operations Center or directly to the Health Department. We work very closely with LabCorp and Quest Diagnostic Laboratories, who we already have an agreement with. So that's our first choice, is to work with those trusted entities that we have agreements with, first and foremost. And then if we have a surge, if you will, or an increase in demand for testing, then we look at our other options as well. But I will tell you that our current agreements have been great, and they've been able to supply us with the collection kits that we need. So I would just encourage folks who do want to get tested, please go out and get tested, either through your doctor's office or to one of the pop-up community test centers.
And the labs that you guys are using, you have not seen any problems with getting results back?
We have been getting results back. There are some, I will tell you that some results do come back unreliable. That could be technique. That could be the individual that actually took the swab. If they're not doing it correctly, they may not have gotten a great specimen. So the lab's going to report that, well, they couldn't say for sure if this is positive or negative. So there's a number of factors involved, but I would say in all of the test results that we received, that's a minimum number.
Jay, if you could step up there for a minute. I have a couple of topics I'd like to drill down a little bit on.
Certainly.
So you threw out a number of 76 million. That's the business impact that's measured to date from COVID-19?
Correct. That's the amount, that's the businesses that have replied to our survey telling us what their impact has been. So it's right around $77 million worth of impact. Pretty significant.
In only about 3 months.
That's correct.
Tell me a little bit about, I know the county is trying to pull together some money and that the figure hasn't been really settled upon yet.
Correct.
But the county is going to try to throw a lifeline to some of these small businesses that either got shut out of the SBA or the state
Correct.
thing. What exactly are you doing?
So what we're trying to do is we're leveraging grant monies and other CBDG funds that we have available to us, that we are going to find a way to help these businesses in many ways. So what our intent is to get an application online to understand who these people are and what their true needs are. Once we identify what those needs are, then we will look at how we can help that through our grant programs and those monies.
So that's money they never have to pay back. It'd be a grant.
That's correct. That's absolutely correct.
And of course, I think some of it is, I think a lot of people don't appreciate, the average individual can go buy some hand sanitizer and some wipes and a mask. But if you are a business and you're throwing masks away and gloves away, that's an expense they didn't budget for.
Well, that's correct. I mean, look, as a small businessman, I will tell you, and it depends on the type of business you're in, a lot of businesses work on a very close margin, especially small businesses. They don't have the ability of the big box stores to work on those millions of numbers at small margins. So anything that they are forced to do as far as additional overhead, whether that's hand sanitizer, masks, gloves, that they already didn't have built into their business model, takes more from their bottom line. And here's what makes matters even worse. They were only allowed at 25%, now 50%. They have to increase and incur more expense, but it can only operate at 50% capacity, which is not even getting them to a break-even point. So it's truly a problem, and it's truly something, we would have hoped that the state would have by now helped us, some of the federal CARES money be trickled down to us a little more readily available. But that said, we in Seminole County have to take care of our businesses and our local businesses, so we're going to find a way to do that.
And that application process is going to start when?
That's going to start within the next week or two.
Okay, another topic. You did this consumer survey. I know you've only had like about 600 or so people that have responded.
Right.
But I was struck by question 1, which is how much is it of interest to the consumer about whether or not the business they visit is using masks, social distancing, and temperature checks. 83% of the respondents have some level of concern. Did that surprise you?
Not at all, and that's why, in the last month or so, as we've talked about, as business was going to be able to open up, and as we waited for these directives to come from federal and state, we knew in my conversations throughout the region with many businesses as well as across the country, we knew one thing. It was not only be safe, but feeling safe. And like you've heard me say before, if you're a business, you may be the cleanest and safest in the world, but if you're not conveying to that customer that they can be safe and feel safe while we're there, they're not going to come. I mean, they're just going to turn around and walk out. Whether you're a restaurant, whether you're a retail outlet, if they don't feel safe interacting with your employees and other customers throughout there, the surveys obviously show they're not going to come back, and maybe for quite some time.
Well, you mentioned it not for some time. Questions 2 and 3 were, are you ready to dine in, and are you ready to shop in?
Right.
There was like 14-15% in both categories that said not till next year.
Correct. Exactly.
Does that put it back on businesses to wave the flag, hey, we're safe?
Absolutely. And I've talked to a lot of the businesses, and you've heard me say during these press conferences, you owe it to yourself as well as the public to convey and demonstrate you're being safe. In order to get the economic engine revved back up, if people don't feel safe, they're not coming out. Even if we flip the switch tomorrow, we know that a good portion of the people are just not going to come do business because they don't feel safe. So it's imperative.
I just have one question for FWC.
Chad?
I just wanted to clarify, are you also going to be, besides looking for people drinking and boating, are you going to be like the mingle police as well out on the waterways, or are you going to leave that up to the sheriff's office to handle that stuff?
Well, we work hand in hand with the sheriff's office, so if there are large groups that are congregating, we do advise them of the guidelines as far as larger groups and ask them to disperse. Is that it? All right.
Well, if there's nothing else, yes, sir. For Deborah? Or Donna, I'm sorry.
Yeah, Jean-Pierre from Radio Haiti. I heard you mention the resident can go to Oviedo for testing, but I did hear you mention for Castleberry. I had listeners from my radio station calling me say they don't know where to go in Castleberry.
Sure. We did have a pop-up event in Castleberry. We call it pop-up community testing at one of the Hispanic churches just recently, just within the last couple weeks. We will continue to have events around the county. So if they go to prepareseminole.org, those events are listed. Also if I know it's not directly in Castleberry, but there is a True Health site located in Castleberry. True Health is testing for folks who go to their facility. So if they want to test, they can go in and they can register them and get a test there, right there in Castleberry. Okay.
Yeah, we can't emphasize enough, if you have a question, don't wait till a press conference. Go to prepareseminole.org, or if you can't find the information there, 407-665-0000. I will assure you, our fine men and women who are bilingual in the EOC will get you the answers and get you the direction you need. Again, thank you all very much. Enjoy your Memorial Day weekend. God bless and be safe. Freddie's going to give our Hispanic translation. He's getting to be a frequent face around here, one of our great employees here in Seminole County. Freddie, welcome. Thank you.
Buen día, este es el resumen español de la conferencia de prensa hoy en el 20 de mayo del 2020. Empecemos con el presidente de la Junta de Comisionados del Condado, J. Zembower. Él empezó hablando del día de conmemoración. El Condado de Seminole se enorgullece en honrando a los miembros de las Fuerzas Armadas de nuestra nación y los iniciaron en último sacrificio en cumplimiento del deber a través de una ceremonia de recuerdo del día, conmemoración en momento a los héroes del Condado de Seminole. La ceremonia será habitual en el viernes 22 de mayo a las 9 de la mañana. Habrá presentación de la Guardia de Honor de la Oficina de Sheriff del Condado de Seminole y el Departamento de los Bomberos del Condado de Seminole. Presentación de veteranos y redención formal de honores con un saludo de 3 voles, tocar taps y sonar la campana final del servicio de los bomberos. La ceremonia concluirá con interpretación de Amazing Grace en las gaetas. Este año, por precaución, los que desean ver la ceremonia en vivo se pueden unirse en la página de Facebook del Condado de Seminole, donde se transmitirá el evento en vivo. La página se escribe facebook.com/Seminole County. Él también mencionó las bibliotecas. Hace más de una semana de que abrieron 4 bibliotecas en el condado con marcas de distanciamiento, limpieza, mejorar y no más de 25% de ocupación. También habló de las empresas. Va a haber el desarrollo económico del condado de Seminole, implementará un programa local para pequeñas empresas para convencer a la pérdida significativa de ingreso durante la pandemia COVID-19. Estaremos dando más información las próximas semanas. Desarrollo Económico del Condado de Seminole también lanzó una encuesta de confianza del consumidor para evaluar qué tan cómodos si tienen los residentes mientras compran, cenan y hacen negocios. Ayudar a los negocios damos los resultados 3 veces a la semana en la página prepareseminole.org. Pueden ir a la sección de negocios para ver los resultados y también realizar las encuestas. También tenemos el director de manejo de emergencias, Alan Harris, que está hablando de las pruebas móviles que continúan mañana y las próximas 2 semanas. Se ha visto en uno de estos sitios traiga una identificación con foto. Los pacientes no tienen que tener síntomas para hacerse la prueba. No hay copago ni cargo para pacientes sin seguro. Mañana, jueves 21 de mayo, 10 de la mañana a 2 de la tarde, va a tener sitio en la escuela Jackson Heights Middle, en la 41 Avenida Academia, en la ciudad de Oviedo. Y también es ofrecido por True Health. Citas no son necesarias. Después, este sábado, el 23 de mayo, a las 10 de la mañana hasta las 2 de la tarde, va a ser en la Iglesia Católica St. Mary Magdalene, que es 861 Avenida Maitland, en la ciudad de Altamonte. Y la siguiente semana, 30 de mayo, el sábado, de 10 de la mañana a 2 de la tarde, va a ser en la Iglesia Renacimiento Cristiano, en 150 Dog Track Road, en la ciudad Longwood. Los sitios de pruebas los sábados son ofrecidos por la Clínica Comunitaria de Musulmana Americana. Para registrarse pueden ir al sitio de prepareseminole.org o llamen al número 407-665-0000. Estos sitios no están ofreciendo pruebas de anticuerpo. Para una lista de más sitios de pruebas, visitan la página prepareseminole.org, que también se incluye sitios de prueba de anticuerpo. También se mencionó de la preparación de huracanes. Había modificaciones al Centro de Operaciones de Emergencia. Uno de los cambios que hicieron, normalmente tienen 114 personas durante tiempo de huracanes, y ahora hicieron un plan para rebajarlo a 34 personas. También hicieron modificaciones a los lugares de refugio. Va a haber grupos más chicos y van a usar más salones de clases en la escuela. Después también se dice que pueden registrarse a alertseminole.org, que se escribe ALERTSEMINOLE.org, que te da más información de lo que está sucediendo. También teníamos la directora del Departamento de Salud, Donna Walsh, que mencionó que desde hoy a las 11:30, 20 de mayo, la Florida tenía 47.471 casos positivos y 2.096 muertes. Hay 444 casos confirmados del condado de Seminole y hay 14.965 exámenes negativos. El número de los casos del condado se está bajando cada semana. La semana de 19 al 25 de abril había 44 casos positivos. Después, en la siguiente semana, de 26 de abril al 2 de mayo, bajó a 41. Después, la semana del 3 de mayo al 9 de mayo, bajó a 15 positivos. Y ahora, del 10 de mayo al 16 de mayo, bajó a 14. El promedio hay de 0 a 5 casos reportados diariamente en las últimas 2 semanas. El virus continúa circulando y transmitiendo en la comunidad. Continúa recibiendo casos. Es importante utilizar máscaras y practicar el distanciamiento social cuando se visita lugares de donde hay mucha gente. También se ha mencionado el síndrome inflamatorio multisistémico en niños, que se ha mencionado, y los casos ocurren en niños que dieron positivos por infección actual o reciente con el virus que causó el COVID-19 o tuvieron contacto con alguien que tuvo el COVID-19. Hemos enviado notificación sobre ese síndrome a todos los médicos y nos estamos comunicando con hospitales y otros clínicos que sirven en pacientes y pediátricos para explicar las pruebas. Estamos creando conciencia sobre este síndrome para que los padres que pueden estar conocer a los síntomas y permanecer vigilantes. También teníamos el jefe de los bomberos, Drozd, que mencionó que el condado de Seminole ha entrado en la temporada de incendios y fortales, y ayer. El presidente de la Junta de Comisionados del Condado de Seminole firmó una orden ejecutiva que emitió una prohibición de quemaduras para el Condado de Seminole. Esto emitió como resultado que el índice de sequía alcanzó a 500 o más. Residentes pueden seguir usando parrilleros de carbón, pero personas que deben de evitar de cocinar en el aire libre y que viven cerca de zonas muy bosques. La orden estará puesto por 7 días y después se verá, revisará de nuevo. Si ven algún fuego, algún tipo de incendio, llamen al 911. Para más preguntas pueden llamar al 407-665-0000. También se mencionó que en medio de que entramos en el fin de semana del comisación es considerado por los asados y por tiempo con la familia, y sea en la piscina de patio, la playa o lagos y ríos aquí en el Florida Central. La importancia de la prevención de ahogamiento. Entre las lesiones preventivas, los ahogamientos en piscinas son principales causas de muerte en niños de 1 a 4 años. Los niños de 5 años o más tienen más probabilidades de ahogarse en aguas naturales como lagos y ríos. Y el riesgo de ahogamiento de aguas abiertas aumentó con la edad. El niño promedio de 10 años, por un ejemplo, tiene 3 veces más probabilidad de ahogarse en aguas abiertas que una piscina. Nunca deje un niño desadentado o cerca del agua. Educa a los niños sobre los peligros del agua y estén atentos siempre. Y si pueden, enséñale cómo nadar. Después, finalmente, tuvimos el oficial Weber de la Florida Comisión de Vida Silvestre, que mencionó de tener cuidado este fin de semana en los lagos y si están afuera en los botes. Cualquiera que tenga 6 años o menos tiene que usar un chaleco de salvavidas. Y oficiales van a estar en el agua este fin de semana buscando si hay cualquier peligro, cualquier cosa de seguridad. Si van a tener alcohol, asegúrense que se acuerden que la ley es 0.08, no más de ese nivel, y que estén alerta de 360 grados de su área, saber a dónde andan, y que tengan una semana que sea sano y salvo. A concluir, si tienen cualquier pregunta o necesitan más información, visita la página preparesemino.org, que se escribe prepareseminole.org, o también puedes llamar al número 407-665-0000. Siempre hay personas que hablan español y que pueden ayudar con cualquier cosa que necesitan. Muchas gracias.